Okay, everyone, we're gonna get started again. My name is Karina Arlucia. I'm one of the founders and directors for PAS Lead, and I'm happy to have two speakers here with me today, Dr. Folusho Ogunfiditimi and Dr. Robert Smith. I'm just gonna give a brief bio on both of them. Folusho is a PA with 22 years of administrative and clinical experience in healthcare administration and urology. Folusho is the administrator of practice management for Florida Health Care Plans. He graduated from Howard University, obtained an MPH from the Medical College of Ohio, and earned a Doctor of Management and Organizational Leadership. His experience spans both inpatient hospital administration to outpatient clinical practice management while providing senior leadership oversight to PAs, NPs, and physicians. Folusho has served on multiple AAPA committees and is the current chief delegate of the African Heritage PA Caucus in the AAPA House of Delegates. He is adjunct faculty at Butler University's Doctor of Medicine Science program, and he is a well-published in national peer-reviewed journals. So thank you for being here with us today. And then we also have Dr. Robert Smith, PAC. He works in family practice at Clínicas Mi Doctor in Irvington, Texas. He is a veteran of the U.S. Coast Guard. He completed his undergraduate degree in science at the University of the State of New York, Excelsior College. He attended PA school at the University of California, Davis FNP PA program. He completed a Master's of Science at Arizona School of Health Sciences, his Doctor of Health Science in Organizational Behavior and Leadership, and completed graduate certificate in education from A.T. Still University Health Sciences. Dr. Smith is certified in diversity, equity, and inclusion by Cornell University. Dr. Smith is involved with numerous professional organizations as a fellow or in a leadership role. He is published and is an invited speaker at local, regional, and national conferences. He's a clinical instructor at the University of North Texas PA program and the University of Texas Arlington FNP program. So thank you so much on behalf of PAS Lead for both of you to be here. Just a quick little breakdown. I'm gonna allow you both to have a moment to give any additional information that you want on yourselves. And I believe Dr. Smith has a few slides he'd like to share with all of us, and then we're going to go discuss all the diversity initiatives that recently passed at this HOD conference in 2021. Folusho, would you like to speak first?
Yes. Can you hear me?
Yes.
Good. First, I want to apologize for being a few minutes late. Today's actually the board meeting for the AAPA board that I sit on. So we had our break at 12. We just ran a little bit over, so I just kind of came over from that standpoint. But I do want to say that it's my honor to be part of this discussion. I think as we're moving forward with the AAPA and the PA profession as a whole, student engagement and student leadership, and particularly student involvement, is critical to where we need to be as a profession as a whole, but also as some of the challenges we face in terms of diversity, equity, and inclusion. So I am glad to be part of this discussion. Would love to kind of talk to you a lot about, where I think the energy that you bring could be best used, particularly as we discuss activities within the House being the primary body that facilitates policy for the PA profession and for the AAPA, but also to kind of get some information from you guys to see what you think we should be working on as a profession, as a board. As most of you may know, I was recently elected president-elect of the AAPA, but I'm going to talk to you today as my former role as the chief delegate of the African Heritage PA Caucus in the House, and how we've been able to move resolutions and policies that are specific to diversity, equity, and inclusion within the organization. So I'd really love to kind of give you guys some information, some guidance, but more importantly, hear from you as to what you think our initiatives should be and how we can continue to make sure that we capitalize on the engagement that we get from students in general. So thanks for having me.
Robert, would you like to say a few words?
Hi. First of all, thank you very much for inviting me to speak. Folusho, congratulations on winning the presidency. I know we're going to have a banner year in getting things done, and I appreciate that, all that hard work that you've done. I did want to take a moment to let you know that the few slides that I have are not really extraneous slides, but I wanted to give you a little perspective on the background of where we are in diversity health issues from the very beginning to today, and where this is really an important part of what we're doing. So thank you very much for allowing me to be here with you guys.
So we're going to allow you to share your slides.
Okay, perfect. Let me get there. Okay, well, here we go. So obviously, you know, this is why we're here. We're looking at this process here. If you see underneath there, I actually set it up for captioning because you never know, maybe some people have difficulty hearing, and I believe in being as diverse as possible. So here's a few disclosures. AAPA Diversity, Equity, and Inclusion Commission on the Board of Trustees for PA Historical Society. I'm president-elect for Association of Family Practice PAs and Ps. It's a national organization. Co-founder, treasurer, chief delegate for PAs for Latino Health. And then I'm the treasurer for a constituent organization in Puerto Rico, Academia de Asociados Médicos de Puerto Rico. So kind of a little bit of the history of the background. You know, it's important to understand the history of where we are to where we're going, and it gives us a better context of why it's important and why this organization has evolved. So in the beginning, obviously, World War II became an outrageous explosion in the domestic product that the United States had to offer. Millions of people started getting third-party care coverage. Medical technologies were occurring, and by 1960, we had civil unrest because people were being not very well represented, and we know the history of our country in that respect. So that was the setting for this, the stage of what we call social innovation in the PA profession. By 1959, the Surgeon General had identified there's going to be a medical shortage of trained personnel, but I highlighted that the lower end of the marketplace was waning. Well, that's because if you didn't have money, you weren't getting health care. So by 1960s, the President John F. Kennedy at that point was really pushing for some social changes in our country. But prior to that, FDR and Truman had really worked on trying to get national health insurance for the country, and that never really happened, and still hasn't totally materialized to today's times. But by the time Lyndon Baines Johnson, the president in 1965, signed Medicaid and Medicare into law, there was already humongous shortages in healthcare providers. So there was a doctor in the 1950s, Dr. Amos Johnson, and he came up with an idea of getting somebody to help him take care of patients. So he got this gentleman, his name was Buddy Treadwell, and he trained him basically to be a PA. The reason he did that is he was very involved in North Carolina. Dr. Amos Johnson was very involved in North Carolina, and he was always going to different events for the Board of Medical Examiners in North Carolina, and he wanted somebody at home to take care of his patients when he wasn't there, thus Buddy Treadwell. So by 1970, Buddy Treadwell was actually given an honorary PA degree by Duke University. Charles Hudson had talked about this in the mid to late 50s and 60s, and actually published an article about expanding healthcare providers to mid-level practitioners, is what he called them. And so that mid-level practitioner thing has been with us forever, longer than anybody really realizes. So by 1964, Dr. Eugene Stead, you're all familiar with Dr. Eugene Stead in Duke, formalized the PA program using medical hospital corpsmen from the military. Interestingly enough, he had tried that same project with nurses, and the Nursing Association basically shut him down and told him that that was inappropriate for nurses. A couple of years later, Richard Smith, who was in the medics program in Washington State, also started the medics program. So here's some major milestones that have helped shape the role and identity of physician assistants. And this is from the very beginning. So the diversity has been interwoven in the fabric of our profession, although it has waxed and waned throughout the years. There was a lot of diversity in our profession at the very beginning because Dr. Eugene Stead was really focused on wanting to address healthcare communities that were being underserved, and that was what we were supposed to do. So here you have 3 pictures of some very interesting individuals. Prentice Harrison, he was the first African-American PA. He also did lots of things in business, and he eventually settled in Houston, Texas, and had his own practice and most recently died, but he was one of the pioneers in PA zoning practices. Joyce Nichols, the first female PA, also a first African-American PA. She was in the 2nd PA class at Duke University. She was a CNA, LVN student. When she became a PA, she was the first and crossed that barrier. And then Steve Turnspeed, he was the first African-American that was accepted and graduated from the medics program out of Washington State. And that whole system exploded, and that was Dr. Richard Smith who did that. So as you can see, the very foundations of the AAPA, Joyce Nichols and Steve Turnspeed were part of the AAPA's board of directors. In fact, Joyce Nichols would go on to start the Minority Affairs Committee the following year and became the first chair of the Minority Affairs Committee. On the right there, you'll see some pioneers, John Davis, Earl Eckert, and Steve Turnspeed. And these are guys who are still around, have been involved in the AAPA. They were founding fathers for the Minority Affairs Committee. They were founding fathers for Project Access. They were founding fathers for the African Heritage Caucus. And they were really my mentors when I started PAs for Latino Health back in a long time ago. Won't tell you the date, it's that long ago. But diversity has been throughout the PA profession. And in 1979, the first caucus to start was the LGBT caucus and the Women's Caucus. And they both became fully formed by 1980. In the late 1980s, the African Heritage Caucus formed, and then following that, the PAs for Latino Health, and then PAs for Asian Health and First Nations caucuses. And there was a need, and people wanted representation for their specific issues, and that's why these groups started splintering, wanting their own representation to make sure that their groups were identified. The lady there you see on the left, her name is Brenda Jasper. She started Project Access. Many of you who are students may be aware of Project Access. Project Access is now done by PAEA, but the whole purpose of Project Access was to go into local communities during national conferences and talk to students about the PA profession. And most of the students were minority students. And that was the purpose of that. And that went on for many years until PAEA took it over. There was a Minority Affairs Committee. Those are some members of that. There's the Native American group. There's PAs that were in Liberia during the Ebola crisis. And you see that picture there. That's a picture at Howard University, and those students are famous in that picture. We also have some very firsts in our profession. Robert Wooten was the first president of AAPA. You see Karen Bass there. She was the first congressman for California. She actually was looked at for a vice presidential nod this last election cycle. And then also she's looking to run for governor, my understanding, most recently for California. So that's interesting. And then you see there on the right, this is you, because there are lots of firsts still to be happening in our profession. There are more now than 150,000 PAs, PA students, certified PAs, and now PA emeritus, which is kind of hard to believe that we've been around 50 years and now we have people actually retiring as PAs. And of course, the PA community has exploded. As you can see, Canada, UK, New Zealand, Australia, Holland, Bulgaria, Puerto Rico, Virgin Islands, Samoa, Guam, Liberia, and huge other countries. But here's an interesting fact: 50 years as a profession, the profession is now 51% female, 49% male. But still, guess what? Minority groups are still underrepresented because we can't get them into schools because STEM programs don't exist as we need them to exist, or their opportunity just isn't told, or, and you guys already are well aware of a lot of the barriers. So how do we get involved? You got to volunteer. So PAS lead, man, this is awesome to see the student body taking the lead, and especially addressing issues at the academic level, because that's really where it starts. There's a gentleman, his name is Les Howard, and Les Howard has been a proponent of community colleges maintaining PA programs. Back in the day, if you graduated from the PA program, you had a certificate. You didn't have to have a degree, just a certificate. You took an exam and you kept that certification and you were good to go. Then we went to bachelor's degrees. Now we've gone to master's degrees, and now we're talking about doctorate degrees. And as we continue to accelerate the entry level, that becomes a barrier. So it's important that you guys continue to address those at the academic level. Then AAPA and constituent groups and other professional groups and local groups. And so that's why myself and Folusho are here to talk about AAPA, SAPA, the House of Delegates. And we're going to talk more about all the different initiatives. This is the HOD policy that was put in place last year, and Folusho was there, as well as myself and other groups representing the fact that DEA had to become a strong policy within the AAPA that made the AAPA, accountable for diversity, equity, and inclusion. So that's what this policy was about. And this year, the DEI Commission is really moving forward to really make this even a stronger commitment for the strategic plan that the AAPA has. And we're going to talk more about that. So I don't want to get on anybody's thing. These are all the different things, and we'll talk about this. So let me get out of this, and then we can go back to this if you want.
Thank you, Robert. I'm going to actually have Folusho share his screen so we can take a better look at one of the resolutions that I found most impactful based on the conversations. I was a voting student delegate this past HOD conference, so I felt and was part of Reference Committee C that oversaw this initiative that was passed. But I was just so surprised on how much contestament there was, and I was really proud to, as a student member of PACE for Latino Health and for the African Heritage Caucus, hearing you both speak so strongly and how and why this is so important. Let me not keep going, but see if we can have Folusho share his screen.
Okay.
So everyone can read it as well.
Yep. I'll get it in a minute. And I want to say, Robert, thanks for that brief presentation. I didn't even know some of that information that's in there. So it's extremely enlightening, and it's something that we need to continue to push and share at a national level as much as possible. So thanks, Karina. I'll share my screen and kind of talk to you guys a little bit about this resolution that we were able to pass into policy for the AAPA yesterday. So just to kind of give some of our students a little context. So once again, the House of Delegates of the AAPA kind of serves as a voice of policy development for the academy. It kind of serves as a mechanism for where different constituent organizations, including SAPA, can come together, put some thoughts together in terms of policy and values, and subsequently submit that to the organization. And if it passes, then it becomes part of our culture, it becomes part of what we aspire to, but more importantly, it becomes part of who we are as an organization. So I don't need to remind all of you about some of the challenges we face as a country relating to excessive use of force by law enforcement agencies that was kind of spurred on by the unfortunate killing of George Wright back in 2020, and all of the protests that kind of emanated from that. The AAPA did take an active role, and they were able to put out a George Floyd, rather, I said George Wright, Diana Wright is who's in my mind right now, but George Floyd. And the AAPA was able to put out a statement around that time about how the PA profession feels like we need to have a better stance around violence. At that point, sitting as the chief delegate of the African Heritage Caucus, in collaboration with the caucus, in collaboration with PALH and other constituent organizations, we felt that this is another opportunity for us to be able to put policy in place that we can now use that will help define what our true stance is as a profession, but particularly also as an organization. So we got a few people together to kind of talk a little bit about this particular resolution. And this is what we were able to, after fine-tuning it and making adjustments and stuff like that, this is what we were able to get as the final resolution and subsequently get it passed in the 2021 delegation of the HOD. And I'll briefly read it. The AAPA denounces the use of excessive force by law enforcement agencies and police officials against all people of color and members of vulnerable population. AAPA recognizes in an effort to achieve health equity, the imbalance in the use of force fueled by racial injustice and inequality must come to a halt. AAPA affirms its commitment to maintaining and securing the safety and health of the public by advocating for effective community policing, robust training and education of de-escalation tactics, as well as the institution of accountability measures for law enforcement agencies and officials. So, and we can share this with everybody in detail. If you want to see it, get it over to Karina to kind of share it with you guys. So that essentially, that preamble is now official AAPA policy. And we worked, I think, for the better part of a year to try and get those 3 paragraphs in place. There was a lot of discussion even before the actual House of Delegates went into session. There was a lot of internal discussions about how should the language be? Should the language be tough? Should the language be a little softer? How effective were we able to gonna be in terms of trying to get all of the delegates or at least a majority of the delegates to vote in favor of this, which tends to be the challenging part of the HOD. So for some of you that have taken Political Science 101, you know how these things work. You get a resolution in place, and then you have to get all of the necessary constituent organizations on board to be able to, for it to pass into policy. Thanks to some of you that were part of that discussion, we introduced this at the HOD. It did go to some reiterations. There were some suggestions, and unfortunately, there was quite a bit of opposition. As you can imagine, there was some opposition to us having a strong stance against the effective use of force by law enforcement agencies. But through research, I think we were able to produce to everyone in the House the impact of law enforcement agents on vulnerable populations, and particularly minority populations and populations of color. We were able to demonstrate that this is not necessarily a knock against law enforcement, but it is a recognition of the attributes that people of color feel every single day whenever they have to have an unfortunate episode or unfortunate encounter with law enforcement agents. And it is important that we look at this as a public health challenge, a social determinant of health, and something that as a health organization, we needed to take a stance on and try to take the politics of whether or not you're in favor of law enforcement or not outside of the realm, but really look at it from the people that we serve are complaining that they're impacted by excessive use of force by law enforcement agents. So we, through, once again, the use of data, the use of collaboration, the use of relationships, and just having a strong voice at the board, we were able to, at the House rather, we were able to push this forward, and it got passed, and it's now a policy of the AAPA. So I want to thank all of you that were intricately involved in that, Karina, for sure, giving testimony on the floor and being able to speak to some of the elements around this particular resolution. And this is the kind of advocacy that we need. And as Robert so eloquently described a few minutes ago, this advocacy has been since the very beginning of our profession. But we can't look at it as, well, we have a beginning and have an end. We're always going to be in this discussion. We're always going to mold. It is important for us to consistently have our thumb on the scale as it relates to what's going on in our external environment, and for us as healthcare providers to be aware of what's impacting the patients that we're seeing every single day. We need to be a voice representing our patients, and it all starts from you guys as students, as leaders, to be able to think about what's going on in your community, what should we be taking on, and not have the fear of not speaking out as a barrier to not being able to effectively protect our patients from this standpoint. All of these things are germane, and it's important that we harness that activity and that energy from all of you. So I'm willing to take some questions if there are any.
Can I add a couple of words to that, to Folusho's statement there? There was a lot of resistance because, just like we have in our society, there are groups of people that don't necessarily reflect the views of those people who are not in a position to dictate. The issue of white fragility exists, and when we have to deal with issues of equity, people who are making the rules don't always want to be giving of, I don't know, for better words, they don't always want to share what they have. They don't want to share their power. And there was lots of things that we looked at this time. You know, we looked at the excessive force policy, and it was Folusho, you can recall, it was a 3 or 4 hour conversation, and it was very heated at times. But we had discussions that whole weekend about racism. We had a policy about racism that was reviewed. We had an issue about establishing a diversity policy. We talked about diversity and disparities in educational opportunities in schools. We talked about culturally competent care and providing those kinds of things. We even talked about giving out a diversity award and why it was important. So we talked about equity and inclusion in all student member chapters. I mean, we're talking about basic things like making sure people of color are represented in school chapters. You know, we talked about admissions and holistic review of different things and how they're looked at for different groups of people. We talked about diversity and inclusion in PA education. You know, the necessary things to teach people to understand the population is going to be seen. We talked about disparities in maternal morbidity and mortality, right? So these are all issues, and these are issues that come up every year. And Folusho will tell you that this next year we have more issues looking at health issues, and the DEI for AAPA has been charged with looking at all of the policies to make sure that diversity, equity, and inclusion are included in the different policies to make sure. And let me tell you, it's a daunting process, and groups like PA's Students Lead is going to be, how do you say, very important. They're going to be necessary because you can't change the old people, but you can certainly change the new people coming in. And the more that we talk about these issues, the more we express these issues, the better it is for us to be able to make changes. Folusho, as the new president, is going to be addressing every single issue. And the important thing when we have somebody like Folusho in a leadership role, he brings the diversity to the table. Correct. Just by virtue of how he looks, right? He doesn't have to say anything. Just by virtue of who he is coming to the table, he brings diversity to the table. And that's so important to have faces of color, and faces of color in our practices, and faces of color in legislature, in PA programs. You know, we can't make changes without getting faces of color. And that's why it's so important that you guys take that lead role in make clankering. But here's the bad news. We talked about the long road, though. Folusho was talking about that it's an incremental process, right? When you graduate school, you're going to be overwhelmed with getting into practice and doing all those things, but you're going to have to keep your hands in everything you're doing right now. You can't stop as soon as you graduate, because it's going to be, you got student loans to pay, you're going to move someplace, you're going to have to find a new place. That's that mentoring thing that he was talking about, you know, finding a mentor. He'll tell you all about that. But the thing is that all of these processes are a fight. And Folusho will tell you, they're a fight every day.
Yeah.
He is an eloquent writer, I'll tell you that.
Yeah.
And he presents things eloquently. And then it's like a dogfight to get people to understand his point of view.
Yeah.
You know? So we have to come armed. You guys are coming armed. You got to continue coming armed. You got to get involved at the SAPA level. You got to get start at all your schools. You got to get people involved at the bases at the schools and get them to understand why it's important. And then, you know, you got to get in your communities, go to your classrooms, go to your elementary schools, your junior high schools, your high schools, and demonstrate yourself. Because guess what? Until they see somebody that looks like them, feels like them, acts like them, talks like them, they can't understand. You know, when I introduce myself, yo soy asociado médico, and I'm speaking, you know, hablar español, por favor. See, you know, you start learning languages. That's what we have to do. We have to be culturally competent and share. Sorry, Folusho.
Not a problem. I do want to address something that's coming up in the chat around some of the fears that students may have, and particularly around being labeled as unprofessional in their programs, which could potentially jeopardize their seats within programs. I understand that completely, and I would never advocate that you do anything that would jeopardize your spot as being a PA. I mean, you're entering a profession that I have been involved in for the past 22 years, and I would not change a single thing in terms of being a PA. So I would say right out the bat, you've made a very, very good decision in terms of becoming a PA, and the future is bright for all PAs in general as we're moving forward. That being said, there's certain that we all have to make certain sacrifices, and part of those sacrifices is not so much as extending to yourself to where you get your head cut off, so to speak, but extending yourself to where you now become a prominent voice on a specific issue. And being able to do that professionally is absolutely within your jurisdiction. There's certain tools that you should be able to count on that you can use extremely well. I can tell you right now that it's really hard to push back against data, right? So gather as much data as you need. Look at the statistics that are trying to push your particular point of view, and be able to be prepared. You know, there's a saying that chance favors the prepared mind. Absolutely, prepare, prepare, prepare. Look at the data, look at where you are. And then along with chance, in terms of you being prepared, also look for opportunities. It's not always the right opportunity for you to now bang on the door and say, okay, we got to do this, we got to do this, we got to do this. You have to be able to read your audience. You have to be able to understand your environment. You have to be able to look at your internal environment, look at your external environment, and capitalize on those moments. I would say, you know, for example, we were able to get this resolution passed, but if resolution has been up, I mean, I think, Robert, if I recall, a similar resolution around excessive use of excessive use of abuse of law enforcement agents, excessive use of powers come up before in the House, and literally DOA, dead on arrival, so to speak, based on it not being the right environment, not being the right moment in time. So you have to be able to understand who your audience is, who you're talking to, and being able to now speak to their interest parts, as well as being prepared with the data that you have coming. And also the third piece about that, in terms of data, understanding your audience, the third piece is being able to know that you're not gonna build Rome in one day. You're not gonna solve all of the problems in one day. So be very strategic, be very specific. What do you want to try and get accomplished? An easy one, and not so easy, but an easy one for students will be to look at your class, look at how diverse your current class is, and say, okay, what can I do? You may not be able to do anything for your current class, but what can I do to aid the upcoming class? Whether it's a seminar that you now develop, that you gather a bunch of people together, you talk to your program director, develop a seminar, and then you go out into just your local schools of where your school is located, either your local high school, your local colleges, and try to expand what you're trying to get accomplished from that standpoint. It's a small piece of the apple, but you're biting it off. And even if you are able to impact one particular person that, or one person of color or one minority that now says, you know what, I'm going to become a PA, then you've done your job, so to speak. So don't try and solve all of the world's problems. Just look specifically at what you can do and take a small piece of that. So those are the three things that I would look at. Look at data, understand your audience, always look at your external environment, and be very specific and strategic. That will demonstrate to anybody that really wants to listen to you that you're approaching this from a professional standpoint, and subsequently, hopefully, decrease that fear of being in jeopardy in terms of your position or your place in your program.
The other thing you need to do is create strategic alliances, partner with other groups that are like-minded, and numbers make a big difference when you're speaking. And sometimes, Folusho will get this, many times at the House of Delegates, when we have an issue that we bring up, we pack the House with people to speak to that issue and just keep beating that same drum, beating that same drum, beating that same drum, beating that same drum. And, you know, eventually people get the message. And sometimes it's 1 year, sometimes it's 2 years, but really collaborating with other people, getting people to support your position is the thing that makes things go, especially in the House of Delegates. The House of Delegates is probably pretty much just like the US Congress, you know, and diversity and right side, left side, middle groups and that sort of thing. And you really have to understand that, and you don't learn that in a day. So how can you get involved? House of Delegates has SAPA, you know, you can do a teller positions, where you can volunteer and work in the House. They have all sorts of different jobs that you can do in the House just to kind of get the lay of the land and get to know who the people are. You know, so you can work on commissions, you can work on all sorts of different things as students as well. So there's lots of ways to get involved at that level if you want to. But the biggest thing is collaboration and strategic alliances. And, you know, your previous lecturers, I was listening to some of their lectures, and, you know, there are all sorts of groups out there, and we collectively need to get together and have a conversation about how we can all do this in unison. I mean, we all have issues, we all have points of view. So it's collaborate, and Felicia is right. When you see an issue or something that comes up, you need to get other people. And don't be afraid in your program to get alumni PAs from your program to get involved, because, you know, they've been there, done that. They know some of the people, and they maybe can help answer some of those questions. And really being a student is difficult, especially somebody made a point about, you know, if you say something, are you a problem student now because you're complaining? You know, maybe you are. Maybe you are a problem student because you're a problem because you're not getting what you need to get your education. Don't be afraid. But it's difficult, especially when, you know, they got your thumb down and you're trying to just get through. But that's that mentoring thing. Find people in your program who have graduated from your program and talk to them. Mentorship is important.
Thank you so much, Robert and Folusho. Just that support coming from both of you as people who have gone through it and in the positions that you are now is just, it's very uplifting. It's very encouraging. I appreciate it. I'm sure all the other students on this call are as well. I know Liz has a question, so I just wanted to address her, and feel free to unmic yourself.
Thank you, Karina, and thank you both for being here and for taking time out of your Saturdays to spend this morning with us. My question is in regards to getting a doctorate. I'm considering getting a doctorate. I've been hearing some of my instructors talk about how important it is, and the direction that the PA profession is headed into the future. So can you tell me what the benefits are to get your doctorate versus having your master's?
Yes, so I can tell you, you know, as an administrator right now, I see extreme amount of advantage to PAs getting a doctorate degree. If for any reason, now I'll tell you right up front that you're probably not going to get any more in terms of a base salary as a clinical PA. However, and this is something all you students should take away, your clinical practice probably only represents about 30 to 40% of what you'll be doing every single day from the time that you graduate, right? So you're seeing patients and those kind of things. It's only going to account for about 30 to 40% of your time. The bulk of your time is going to be understanding processes, systems. How do you get a prescription that you've written for a patient, for that patient to take that prescription, make sure that he is compliant with the prescription you've written, and to get him to follow up with you in the clinic. Those things are things that you don't that we don't currently teach in school, but you'll have to learn on the day of, right? So it's one thing to say, oh, I have all of the knowledge, I know exactly what prescription to write for you. And as Robert will tell you, you give that prescription to a patient and patient says, thank you, doctor, this is exactly what I need. And then 2 months later, that patient comes back and it still has a problem. Say, I gave you this prescription, why didn't you fill it? And then you sit to listen, well, I have this, I have this, I have this, I have that. So the point I'm trying to make is that, you know, getting a doctoral degree at least broadens your horizon on multiple levels so that you're able to now be in a better position to be able to navigate the practice of medicine, so that you're better in a better position to navigate the business of medicine. You're in a better position to be able to understand what healthcare really is and understand that healthcare is so much more complex than writing a prescription for blood pressure medication. You know, and I don't mean to minimize it in any kind of way, but we've been practicing for quite some time, we struggle with this all the time. You know, how do you navigate through policies? How do you even get your voice heard, so to speak? Now, most organizations and healthcare organizations are warming up to PAs being actively involved and sitting on various committees and those kind of things. But historically, it's been hard for us to get onto those committees. So having a doctorate degree tends to level the playing field a little bit. Gives you a wider variety. It may not give the person you're talking to any more respect for you, but you now have a wider range on how to approach that person that's right in front of you. Whether that person is a CEO, whether that person is an administrator, whether that person is a physician who sits on a critical committee or a critical board that you need to be able to get into in terms of advocating for your patients. So it gives you that opportunity to have a wide variety of activities. And one of the things that was critical on my platform is really looking at expanding non-traditional roles of PAs, being able to get PAs on a wider variety of roles and responsibilities, and having a doctorate degree absolutely facilitates you. I mean, there's just a wide range of things, and I won't bog you guys down, but you know, things like research and being able to be part of basic science researches, all of that is facilitated by a doctoral degree. So I would absolutely, if you can, I would absolutely encourage it from that standpoint.
Well, let me chime in on that a little bit also, Folusho. So for me, I've been in clinical practice most of my career. I've not been in a big corporation or an academia situation. The reason I got a master's degree is because I wanted to make sure I was competitive for licensure around the country, and NPs coming out of school had master's degrees. So I wanted to make sure I was competitive. The reason I ended up going to getting a doctorate for myself was I had applied for the Minority Health Committee for the United States. And guess what? Everybody that's selected was a doctor. They said, hey, very nice. Thank you very much. Have a nice day. Even though I had been doing minority health for 20 years, I could not get to the table because I didn't have the credentials. That's why I went back to school. On a personal note, as you go to school and you do the doctorate level, you know, there are all sorts of doctors, doctor of health science, doctor of medical science, and you're like, okay, which one? You know, doctor of medical science, PA studies, and so forth. And they're starting to come more and more and more, and eventually it may become the entry degree. Now, something to think about. We're the only profession that is not a doctorate level. OTs, PTs, STs, athletic trainers, optometrists, and so forth and so forth and so forth. We're the only one that's not. We are getting paid as well or better than most of those people, honestly. But we're not at that same level academically speaking. So Folusho is right. It's going to open some doors in different arenas for you. You spend 15 years, 20 years, maybe you want to go into research. Well, the doctorate programs teach you how to do the research. And also, guess what? When you're looking at science, you understand if it's junk science or real science. Then you know what's good science, what's bad science, what's right, what's wrong. And then when you're educating your patients, you got that. So do you need a doctorate? Not yet. But I bet you if I was putting my money down and we're going to Las Vegas, I bet money we're going to need to have that doctorate. Look, you got a guy there, Folusho, who's in charge of an organization, who's super duper head of charge of everything. He's a doctor. He gets at that table and he's talked to doctor when he's at that table, because he's got that credential. When you're in academia, you're a doctor, you're a professor. You're not an assistant professor, you're not a clinical instructor, you're a professor. If you want to make a change as a minority student to other people around your world, get that doctorate. I know it's a pain in the butt. And you don't have to do it right away. Go do clinical and pay some of those loans off. Eventually, you're going to have to get there. I will tell you, taking a break and going back to school is difficult. And then you're married and you have children, it's more problems. And then you're married, children have a business, more problems. It's, you know, if you can buzz through right now and take it, because eventually you're going to end up deciding you're going to do it. And guess what? It's going to be more challenging. So he's right. It's opportunity. Don't limit yourself. This just opens the door more for you. And clinically, you're not going to get paid more. I don't get paid anymore. I will tell you, when I got my master's degree, it made a difference in credentialing. So that's when it made the difference. And eventually it's going to be the same thing with, you know, because all the NPs are coming out, doctors and nurse practice.
Yeah.
And they're not better educated, I'll tell you that. I promise you, because I teach these students all the freaking time.
Yeah.
And they're not better educated. We are. However, they're coming out with a doctorate. We're not.
Thank you so much to both of you for all this great advice. I definitely learned so many things I did not know before. I definitely didn't think I would want to even consider a doctorate after finishing school. But these are great things to think of that you really don't get taught in school during PA education.
There was a question there about the advantage of PhD, DHS, DMSc. Okay, so let me answer that question for you. And I have a good, nice slide, but let me answer that question for you. If you go to Europe,
yep,
they would rather have you have a doctor of health science or a doctor of medical science because you're a specialist in that field. A PhD is a doctor of philosophy. So you just think about stuff. When you do a DHS or DMS, guess what? You're doing research and it's clinical application, and you actually do that. So it's not theory, it's application. So in Europe, definitely they want that. You know, PhD, I'm not minimizing PhDs. They do a great job, but they're not learning any more research than you do as a doctor or DMS, doctor of health science or doctor of medical science. They're not doing it anymore. You still do an applied research project. I know I did. And you still do a presentation that you may not have the quote, you know, give you the quote dissertation kind of thing, but it is exactly the same thing. You do all that. So there's really no advantage for PhD, DHS, DMS at this point. That is all becoming a skewed line. Used to be maybe in academia, I'm not sure, but I'll tell you in the medical community, worldwide pharmacology and all that, that line is being skewed now. That line is blurred. It's a doctor.
I would agree with that completely. A DMSc, DHSc, some of the DM like mine, these are professional doctorate degrees. You still have to write a dissertation. You still have to come up with a problem that you're trying to solve, and you still have to follow that same format. PhDs may be more applicable in academic settings, but have any of you thought about what an MD really is? An MD is a professional doctorate degree. It's not a doctor of philosophy. It's a professional doctorate degree, just like a DMSc, just like a DHC. So there's one thing that an attending physician of mine used to say. He was like, what do you call the last person who went through a doctoral degree, who got the worst grades, but was able to graduate at the end of the day? The truth is, you still call that person a doctor. So exactly, doctor is still who you call that person, as long as you finish what you have to do. A lot of it is, yes, you want to be able to go for it academically, and you want to be able to get the degree. But a lot of it is the content of what you're going to be able to do with that information, the content of what you're trying to get accomplished. That's what really defines you. So it depends on what you want to do. I don't think there's a significant amount of added weight. Maybe back in the day, you know, a PhD used to be the gold standard. I don't think it is the gold standard anymore. I think there are a lot of professional doctoral degrees now that have the same amount of applicability that you may need. So the key is to get it and do something with it more so than anything, at least from my viewpoint.
And I just saw another question, if either one of you could answer this, from Kayla. Would we have loan deferment during a doctoral program?
Yes.
Yes, yes, you do. Yeah.
And
as long as you're a student, you do.
Yeah, full time. And then also, I don't know if Folusho knows this, he probably does, but you also have access to more money if you need it. So to live on and to pay bills and all that, you have access to a lot more money in the graduate doctorate program.
And then there are minority specific grants available as well too, that you should absolutely explore, with the goal of trying to, you know, for example, you know, some organizations, if they're interested in your dissertation could be something that could add to the literature, to the academia. They're willing to give you some money to be able to facilitate that. So there's plenty of options out there for sure, that you can explore.
Yeah, and also don't be afraid. Ask money from the National Hispanic Medical Association. They have lots of scholarships. NMA has scholarships. Asian group has scholarships. The gay and lesbian group has scholarships. I mean, all those groups have scholarships to help people like us get where we need to get. But remember, you got to pay it back and you got to pay it forward.
Also, touching on that, do you have any advice how, I believe some jobs can also help pay for your doctorate as well?
So some jobs do, not so much as PA roles specifically, but if you, for example, some universities and academic institutions may facilitate some form of tuition reimbursement, or may even grant you full ride if you're doing your doctorate degree at their facility. So that's helpful. Some health organizations will do the same too. If you have for example, if you sit on a major committee and you can make a good proposal that by you getting this doctorate degree, you'll be able to benefit. Some hospitals, most hospitals and health systems have an educational tuition reimbursement policy that they give $3,000 to $5,000 or so. And some of them don't have to be very specific as to what you do. As long as you maintain certain grade levels, they will give you that money, and they know that ultimately it'll benefit them. So don't limit yourself by not thinking that those don't exist. What's the worst thing that they're going to say? No. Well, that just tells you you don't have the money that you didn't have to begin with anyways. So, so absolutely explore whatever options may be out there, and see where you end up. More than likely, you'll get some external money. There's so many opportunities out there that somebody will give you some money to do something.
Thank you again. I know we kind of went over our time a little bit, but we truly appreciate both of your perspectives and advice and support. For any students here, just want to let you know, Dr. Robert Smith is from PAs for Latino Health, and Dr. Folusho Ogunfiditimi is from the African Heritage Caucus. So if you join as a student member, they'll still be there to continue help and guide you. They're always available. Oh, Robert already put his email in there. So I definitely highly suggest any students who are interested to join both of these caucuses. Like they mentioned, these also have scholarship opportunities. I've been very grateful and fortunate to have received one from both caucuses, and it really does help you out just paying books and traveling to clinical sites and things like that. And I'll be happy to share some more information afterwards. I know we have to start the next discussion, but thank you again for being present.
Thank you. I have to jump back into the AAPA board meeting for the afternoon session. But it was great being part of you guys, and keep that fire burning. We need as much support as we can from all of you. And Karina, I'll put my information there. We can send out as much information as we can through you to this group. But thanks for allowing me to be part of this.
Doing all that for me, and thanks again, Folusho.
Yep.
We're calling you, brother.
Absolutely, my brother. Absolutely. All day long.
Love
All
you
right.
guys. Thank
Love
you guys.
Bye.